So let's talk a little bit about how you're going to organize your oral presentation. As I said before, you're going to follow the basic outline of the written record, but you do not have to comment on something from each individual section of that written record. If there's nothing relevant in the social history that pertains to the HPI, you don't even need to bring it up. If there's nothing relevant in the family history to the patient's chief complaint and their history of present illness, you can skip that in the oral presentation. Again, if the team has a question, they'll ask you about the family history at the end of your presentation. So again, don't feel it necessary to comment on something from every single header. But this is what you do need to comment on. Again, you need to give us the patient's age and their sex as their identifying data. You do need to give us the chief complaint, and you do need to tell us the HPI as a story. And then you can skip those sections that don't contribute to the differential diagnosis or your diagnosis. Now, having said that, I think it's always important to include the list of the patient's medications. You don't necessarily have to tell us the dose and the frequency, but it's important to the team to know if the patient's on 5 different medicines, what those 5 different medications are. And furthermore, if you took that history and you don't know what 1 or 2 of those medicines are, you better look that medicine up before you give your oral presentation, because that can be a real clue to their other significant medical problems. And then allergies. That's always something you want to include in an oral presentation, because that could affect the therapeutic plan that the team's going to come up with. So if a person's allergic to an antibiotic or IV contrast dye, make sure you mention that during your oral presentation. Again, as I mentioned before, maybe you don't need to mention anything from the surgical history. If it's just, again, if they have chest pain, you don't need to know about bunion surgery or that they had their tooth extracted 2 years ago. You don't need to know about their childhood immunizations if they're coming in with chest pain. So again, you could just totally skip those sections. And then when you go to the physical examination, the vital signs are vital. So make sure you make a mention of the vital signs. If they're all normal, it might be enough just to say that the vital signs were normal. But if they're not, let the team know what those vital signs are. If they have a fever, tell us what the temperature is. If their blood pressure is high or low, give us the numbers. Tell us if you checked it again yourself. And do comment on the patient's general appearance too. If this is a patient who's chronically ill and is cachectic and looks seriously ill, let the team know that. Nothing is more unnerving or unsettling to an attending or a team when they think the patient is basically fine and healthy and they walk in the room and they're totally surprised by the patient's appearance because nobody warned them how sick the patient was or warned them about their general appearance. So again, make sure you've got a couple good phrases to let the team know what the patient's general appearance is. Of course, the content of your oral presentation will vary depending on who you're giving that presentation to. Again, if you're presenting to other students in your class, you're probably going to need to give a little bit more details just because you're not really sure of all of the facts that lead to a differential diagnosis or help confirm a diagnosis of a specific disease. When you're on rounds with your team, 3 to 5 minutes is a good goal. And again, practice ahead of time to make sure you can say an oral presentation in 3 to 5 minutes. A general rule is more is not better. For example, if you're on rounds and there's 10 patients that they have to, new patients that were admitted that the team needs to hear about, if somebody tells you, well, just be brief or go on, that doesn't mean talk faster. It means that they want you to edit out information that's really not important or it's not contributing to that differential diagnosis. So again, the faster you talk doesn't gain you any extra points in an oral presentation. And you will be interrupted. Ideally, you'd like to be able to tell your whole story and give your presentation as you've planned, but you can anticipate that people will ask you questions and interrupt you. So don't be surprised by that. And don't be surprised by the fact that every attending wants to hear things a little bit differently. Even if they're in the same specialty, one attending wants maybe a little bit more past medical history than the other. Certainly, depending on the specialty of the attending, different things are important. So for example, when you're doing your pediatric rotation and you have a young child or an infant that you're presenting on, I can guarantee you that the pediatrician is going to want to know about the birth history. They're probably going to want to know about the child's growth curve or their growth status as well as developmental milestones, whereas that has no bearing on an adult patient. So again, be aware that each specialty is going to have its own unique data points that they're going to want to hear about on an oral presentation. And pay attention to those other members of your team, the residents, the interns, the fellows. Watch how they give a presentation. Again, this is a skill. This is not something that anyone can give you 5 ground rules for and they'll always be right. This is something that you have to learn to be flexible. Oral presentations are very fluid. And so you have to kind of live with that tension and live with that frustration as you initially stumble through your first few oral presentations. You will get better at this the more you practice. But again, it takes practice. Read about your patients, know your patients inside out, and persevere, because you will get better at doing these. Many times you'll be asked to do an oral presentation after you've been up all night on call. That's typically when you get the most number of new patients. And I would encourage you to pay attention to your body language the next day when you're presenting on rounds. Don't look like you just rolled out of bed. If you have an opportunity to change out of your scrubs and back into street clothes, do that. For God's sakes, comb your hair. You don't want to look like you just rolled out of bed, because your appearance is part of your presentation. If you look sloppy, if you look disheveled, the team is much less likely to respect and take your observations seriously. Make eye contact with the team. Nothing is worse than having someone do a presentation and have their head buried in a piece of paper. You should know that patient well enough that you only periodically refer back to your notes or your write-up. So don't read verbatim. Make eye contact with the team and pay attention to your appearance, because that's all going to be part of how you're perceived. And remember, as you progress through your medical training, the oral presentation is really one way for the attending to assess and evaluate you. The attending who you're assigned to is going to try to figure out, do you really know the patient? Do you really know how to take a history and do a physical exam? Can you identify abnormal findings based on your oral presentations? So this is a very important way that we in medical education assess a learner's progress through a clerkship or through a rotation. So you want to put your best foot forward. You want to do a good job. And again, your appearance is part of that, your body language. So pay attention to that. So in summary, a few key points about oral presentations. Make sure that you can do your presentation in 3 to 5 minutes. And again, that doesn't mean racing and talking as fast as you can to give as much information. Always give us the patient's age and sex. Give us their chief complaint. Tell us their story in terms of an HPI. Tell us the patient's perspective. And then as far as the rest of the history goes, just include those elements that you think are key positives and negatives around that HPI and chief complaint. When you get to the physical examination, certainly comment upon the vitals, comment on the general appearance, but then only tell us about the physical exam steps that are really relevant, again, to the patient's chief complaint and HPI. If this patient's been in the hospital, you might want to include some of their laboratory studies that have been done prior to rounds. So if they've had some blood work, some EKGs, radiology tests, tell us about what those results are before you tell us what your differential diagnosis is. And again, an assessment and plan is what is expected from you. We want to know how well you're thinking. We want to know how well you've put this data together. And that's really the difference between second year and moving into third year and beyond, is your thought processes. You've gathered this data, now what are you going to do with it? How are you going to help your patient with this data? How are you going to come up with their diagnosis and a treatment plan? So again, we do expect you to sit and think through the information you gathered and try to make sense of it. That's why you're going to medical school, and that's why you want to become a doctor, is to make that next leap from someone who's just gathering information to someone who's gathered that information and now can take it to the next step and make a diagnosis. Good luck.